I'm now going to speak a little bit about our safety plan. And this is a document that you can download and print at home, or you can copy out the questions that you see on the screen here, and just handwrite them out if you have to, if you don't have access to a printer. If you sometimes struggle with suicidal thoughts, complete the form below. When you're feeling suicidal, follow the plan one step at a time until you are safe. Feeling suicidal is the result of experiencing extreme pain and not having the resources to cope. We therefore need to reduce pain and increase coping resources. And to do that, you're going to have a plan. This plan is better written when you're feeling okay, when you're clear-headed, as much sleep as you can, thinking as clearly as you can, and getting as much information as you can written down on this bit of paper. This isn't just helpful for you, but it's also helpful if you're not in a position to communicate with someone else, then they can follow this plan or help you to do it as well. What do I need to do to reduce the risk of me acting on the suicidal thoughts? So for this, you could write down removing all sharp objects from the house, or paying attention to HALT, for example, which is covered in our suicide prevention booklet. Hungry, angry, lonely, tired, things like that. You can write those down. Any existing coping mechanisms that you have that aren't maladaptive, so drinking or something like that, those can stay off of the safety plan. The aim of the safety plan is to keep you as safe as possible, and for other people to know what keeps you safe as well. And this can be different depending on, you know, if you're a self-harmer, or you know, if you abuse substances. Like, everybody's circumstances are going to be different, and it's important for me to say that there is no right or wrong way to do this. What warning signs or triggers are there that make me feel more out of control? In terms of warning signs and triggers, you're gonna want to write down. I mean, without thinking too much in depth, have a think about other things that have kind of really made you feel at your absolute worst, and make note of those so that you know to avoid them in the future. So for example, if you're already down and you watch a particular film or listen to a particular album, then you'll know to avoid that if you don't want to feel worse. You know, what have I done in the past that helped? What ways of coping do I have? So this is what ways you currently have of coping. We try to avoid things, like I said, like mentioning alcohol, or anything that could put you in immediate danger. Avoid things like that if you can. For some people, they'll make a box with their safety plan, and it'll have things that comfort them. So smells that they like, it could be the perfume of a loved one, or snacks that they really enjoy, a stuffed toy, a blanket, like things like that, things that just make them feel good. A self-care box, I think they're called. If in the past you've phoned like a particular friend, or you've watched a particular thing, or you've done this and that, done some exercise, something like that, that's what you write down there. Anything that makes you feel better, that has no potential to make you feel worse, you put it in there. What will I do to help calm and soothe myself? This is probably actually where you would write down, get out my self-care box, or you could do, you could write down having a bath, or go for a walk, things like that. Just the little things. What will I tell myself as alternatives to the dark thoughts? So this would be, you write down like positive affirmations about yourself. So I mean, you don't have to write all of these down on the same day. These affirmations could be that you're an amazing artist, and you are really talented at singing, or you're really good at this, or you're really good at that, or you have a lot of friends, or your family love you. Anything that is positive about your life, like wait until a really good day to do this bit if you have to, and write down all the stuff that you really like about yourself and that you would want you to know when you're really feeling down. And you can take as much time as you want on that, because dark thoughts, they can turn into feedback loops, and what we need to do is reduce the likelihood of that turning into a loop. So we need to hear something different to what our mind is telling us. So the more things that you have there to read in place of those dark thoughts, the better. What would I say to a close friend who is feeling this way? With this, I guess it's all hypothetical, but if you have had a friend that has felt this way, and you've been there for them, they say that you shouldn't speak to yourself how you would, you know, you shouldn't speak to yourself how you wouldn't speak to somebody that you knew. So you wouldn't be really mean to a friend and be like, you should feel better by now. You wouldn't say that to them, so don't say that to yourself, is essentially the meaning of this question. What would you, I guess it draws on, those positive affirmations that we spoke about. Um, just use this space to say what you would say to somebody else. And that has a more objective kind of perspective on it. So take out all the things you feel about yourself in your life. Like, how would you speak to somebody else who was feeling this way? What advice would you give them? What could others do that would help? So if you live with somebody, or somebody else is going to read this, you can write it with the intention of somebody reading it. And this is where you would say things like, if I can't speak, then do this, do that. If cuddles help, then write that down. If cuddles make it worse, write that down. It's just communicating what you might not be able to communicate at the time. Getting your medication, making sure that you've taken it, things like that. Who can I call? Use the space below to write the names of any friends, relatives, healthcare professionals, or other people that you trust that you could call or contact in the event that everything gets too much. This can be anybody. It can be friends and family, it can be close friends. If you're a part of any recovery groups or anything like that, write down some numbers there, like sponsors, for example. In our suicide prevention booklet, we have a whole list of numbers and charities and people that you can phone in that instance as well. Obviously, if you're in immediate danger, you're going to have to call 999. That's a given. So this is our safety plan. Yes, it's in here, suicide awareness booklet for additional numbers. Keep this in a place that you can easily find it. Don't hide it away anywhere where you might forget where you've put it. You don't have to have it like on the wall or anything, but you could if you want. And we do recommend taking a look at a self-care box because it's a great way of distracting as well. This is a part of the suicide prevention booklet. And if you can, you should make notes of some of the coping strategies that are included in that booklet too.